right, welcome everyone. We are Plant-Based Kidney Health. I'm Sean Hashmi. I'm a board-certified obesity medicine specialist and nephrologist. My partner is Michele. You all know Michele because she has all these excellent things to tell you about how wonderful, delicious food is. I just tell you how now to have the pain of kidney stones. So today is an interesting topic. We're going to talk a lot about physiology. We're going to talk about what happens when you get a nephrectomy. So there's some really interesting stuff. But Michele, before we get started, I wanted to tell you, I decided to go back to jiu-jitsu. So I broke my finger, I messed up my knee, messed up my neck, got a black eye. And I was like, my wife was really mad at me and she's like, listen, you can't be broken all the time.
You can't be broken as a doctor.
Yeah. So I took some time off and I watched my kids and I'm just like blown away at what they're doing. And I was like, maybe I can do old man jiu-jitsu. So I don't know what that is yet, but I heard on Google, since Dr. Google knows everything. So I'm going back. I'm trying to go easy and knock on everything that this time around is going to be successful for the long run. But I'll keep you guys posted. I don't have any broken bones yet. So very excited about trying to do something positive in 2022.
I love that. Yeah, we'll keep an eye out and make sure you don't come with any finger splints or...
Yes.
Okay.
So what do we have to start with?
So as you mentioned, we're talking about today nephrectomy, solitary kidney, and I'll let you explain a little bit more on that. And then of course we're going to get into, nutrition and health and kind of testing around that. But if you can start and explain, what is a nephrectomy? What are some reasons that someone might need that? And then how does that impact their health, their kidney function?
Yeah, so starting with the definition, nephrectomy simply means that you're just taking out either one or both of the kidneys. Now, there's a couple of terms that your doctor may use, and they may sound very fancy, but here's how it works. There's something called a radical nephrectomy, and radical simply means that it's complete. So in the medical field, we say radical. I mean, it sounds like, oh my God, it's going to be so bad, but it means that they're taking out the whole kidney. Then there's partial, which just as the name sounds, they're taking out a portion of the kidney. And we're going to talk about specifics why we do each one. Now, some of the reasons why your nephrologist and urologist, usually it's the urologist that's the surgeon, the nephrologist, which is a medical doctor like myself, they'll talk about it for a number of reasons. So first is renal masses. So if you have a mass in your kidney and it's a certain size, and what's that certain size? Generally speaking, if you have a kidney mass and it's less than about a centimeter, those ones, you don't want to touch them. You don't want to biopsy them. You want to watch them. So we call that surveillance. So less than a centimeter, you want to watch it in surveillance. The ones that you really want to be concerned about are the ones that are really 3 or more centimeters going on. And so 3 or more centimeters is a high risk factor for them to be cancerous. But the other risk factor for them to be cancerous is when they're growing fast. How fast? If the size changes by more than 5 millimeters each year, then that starts to become more concerning for it. And also, if it looks like that mass is becoming what we call infiltrative, which means instead of being very discrete and round, it's starting to spread into other areas, that is also very concerning. And all of those reasons are why somebody would talk about a nephrectomy going on. Now, so renal masses is one of the things we look at. Another one is what's called autosomal dominant polycystic kidney disease. This is a condition where you have so many different cysts forming on your kidneys. Your kidneys can become huge. We're talking 20 centimeters. So imagine they're the size of 2 small basketballs that you're carrying all day. So some people can have such bad pain, vomiting, discomfort from it that they end up having to have surgery. Even when they're getting kidney transplant, there might not be space to put the transplant in because it's pushing so much. So they might need a nephrectomy. Another reason is in patients, for example, they may be on dialysis and the kidneys are already shrunk, but it's causing really high blood pressure. Or even though the kidney is getting very little blood supply, it's hyperactive. And so that renin-angiotensin-aldosterone system is revved up like crazy, and you have really hard to control high blood pressure going on. That's another reason why they may end up taking the kidney out. So those are just some of the reasons why this ends up happening.
Okay. And thank you for explaining that. So then obviously if someone has a nephrectomy, obviously partial, then, part of it's removed, or even if the full kidney's removed. So they have then one kidney. Assuming they were born with two kidneys. So now they have one. So now that person has one kidney. And let's say someone who was born with one kidney, or someone who has donated their kidney and now has one kidney. So now whether they had a nephrectomy, they were born with one kidney, they donated their kidney, now have one. What are some just health or considerations around a solitary kidney?
Yeah, so the interesting part is when people donate a kidney, or if people are born with one kidney, more often than not, they have completely normal kidney functions moving forward. And the reason is when they take out that one kidney, the other kidney takes over the function of both kidneys. So, my running joke with all my beloved cardiology friends is what's the most important organ in the body? It's kidneys, because there's two of them.
Yep.
Okay, that's a bad joke. Nobody gets it. So if you laughed at that, thank you for laughing at it. I find it very funny and amusing, but my cardiology colleagues do not. So if you look at in terms of what happens when you're getting like a radical nephrectomy going on or other stuff going on. So there's some recent studies. So Zabor and colleagues in the Journal of Urology, they had a study, and what they showed was, this was published in 2018, what they showed was that about 45% of the people, they recovered their complete kidney function within 2 years. So in other words, after the nephrectomy, it took up to 2 years before the kidney function stabilized. So you could still see improvements up to 2 years going on. And that's really, really important to remember. Now, here's some stuff that's important. If you're getting a nephrectomy, what are some things that will put you at a higher risk for getting kidney damage through the surgery? So there was a study published in 2020, and this is a really good one because they were actually able to come up with a very algorithmic approach and quantify what the risk was. And what they really showed was, one, of course, if you got a radical nephrectomy over something like a partial nephrectomy, your risk of having acute kidney injury was higher. If you were somebody who was using aspirin on a daily basis before having the nephrectomy, your risk of acute kidney injury was higher. If you went in and had higher blood pressures, that increased your risk. If you had higher triglycerides, which is cholesterol, that increased your risk. If you had higher liver marker, which can also be a bone marker called alkaline phosphatase, that increased your risk going on. So those were all of the things. And then the one risk factor, which is important to understand, is if you went in with a higher kidney function, in other words, your GFR was 60 to 90, which if you don't have protein in the urine is normal, then your risk was much lower than if you went in with already having chronic kidney disease. So in other words, if God forbid you do have a mass, you want to listen to all the other stuff we talk about, which is maintaining healthy weight, having a plant-based diet, doing all those things, because that's going to keep your kidneys from having issues. That's going to keep your blood pressure lower. That's going to lower your risk for having kidney disease in the first place, right? That's going to lower your risk of having diabetes. So that's why it matters. But those are the basic things for if you have to worry about a nephrectomy.
Okay. Got it. And so how does, I guess, can you explain a little bit more? Because obviously, let's say you have two kidneys and one is removed. So you have obviously like half the renal mass that you had before, and let's say half the amount of nephrons, those filtering units of the kidneys. And you said it can take up to 2 years for, your kidney to kind of get back to normal kidney function. So can you talk a little bit then about, is there hyperfiltration that goes on with that one kidney that's remaining? And then is that something that outside of, like, let's say someone doesn't have other, they don't have high blood pressure, they aren't obese, they don't have diabetes, they don't have these other things, that kidney, they're good with that, the rest of their lives, or are they at any higher risk of getting kidney disease or having end-stage kidney disease themselves?
Yeah, so, what's interesting about the kidneys is you can lose 40% of your kidney function and it won't reflect in your blood test because the rest of the kidney will actually work harder to do the work of what's been lost. So in other words, almost half of your kidney is gone, yet your blood tests don't show any elevation in your creatinine. So this, what it tells us is that even when you're down to one kidney and one kidney is taken out, that kidney does the work, the cleaning of the other kidney. So the question becomes is, are you at a higher risk? Well, you have certainly lost a lot of your kidney mass. So if you continue to stress that kidney out, you're taking a lot of NSAIDs, you're putting in a lot of acid load into your body going on, you have high saturated fat, all of those things are going to put pressure on your kidneys. So if you have one kidney, it's very important to even pay more attention to your overall healthy lifestyle going on. But then keep in mind, if you end up having things, for example, a partial nephrectomy, right? People do really, really well after a partial nephrectomy. So there is a small chance of things like, for example, there could be a bleed, there can be a urinoma. A urinoma is nothing more than basically urine that kind of gets stuck in an area, and so it's encapsulated. That's just what a urinoma is. Both of those things, if there's a little bit of bleeding or there's a urinoma, they both get better without doing anything. So even if that happens, it's still okay, but a partial nephrectomy ends up having very, very good results. Even if you took out pieces from both kidneys, you would still do very, very well. The important thing to remember here is lifestyle matters so much when you think about this. And is there going to be a chance for hyperfiltration? Well, it really depends on what you're doing. If you're driving a lot more protein through it, if you're driving a lot more sugar through it, right? In diabetic kidney disease, what do we see first? The small kidney gets larger, 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 larger. And so it hypertrophies because it's hyperfiltering like crazy. Then it starts to die. And that's why it shrinks. So when you get somebody with diabetes who has a normal kidney size, that doesn't mean that their kidneys are normal. It could mean that, yeah, you caught them early enough, or it could mean that their kidneys already got larger. Now they're dying, and that's why they're back to the normal size again.
Got it. Okay. Thank you for explaining that. And that's obviously what we're going to dive into more, but just even more emphasis on, and I get asked this a lot, hey, I have one kidney for whatever reason it was. Do I need to worry about what I eat? Do I need to worry about diet? Do I have to follow a kidney diet? And so that's where you want to be, very on top of your lifestyle and stuff, just like someone with kidney disease with two kidneys, one kidney without technically having kidney disease. It's just as important.
Yeah, so when people ask me that question, they're like, yeah, I got one kidney, but my phosphorus is normal. Do I need to be on a low phosphorus diet? The answer is yes, your phosphorus is normal. And you want to think about what are those sources of phosphorus that we worry about. If it comes to things like meat and dairy and stuff like that we're talking about, in general, we want you to come back and cut that stuff down anyways. Maybe you're somebody who like sweet potatoes and your potassium is normal, and more power to you, then you can have your sweet potatoes. But maybe you're somebody who can't. So in other words, this is really about making healthier choices. And the kidney diet, believe it or not, is the same diet that's the heart diet, it's the brain diet, it's the GI diet. All of those diets, the fundamental concepts are the same. So if you're looking for our permission to follow a healthier lifestyle, you have it.
Yes, definitely. And some of the, what I would say, some of the specific nutrition considerations that, hey, you have one kidney, you've had a nephrectomy, or you're born with one kidney, then it's similar to, like you said, it's general healthy food and lifestyle where we want to be limiting the processed foods and these like sugary beverages. But we do also want to keep in mind the, avoiding the excessively high protein diets, especially if it's all coming from animal protein, and avoid excessively high sodium intake. And getting, proper hydration as well. Preventing dehydration is important. So I think, that's advice and we could give to someone with kidney disease or with one kidney, but also that's what we would give to anyone without kidney disease. But from that standpoint, I think it's important that everyone understands that getting more of these whole plant foods in the diet, it's not just to protect your kidney. It's because like you said, it improves gut health and heart health and all these other things that are interlinked and intertwined with kidney disease that we oftentimes don't think about. And, we want to prevent high blood pressure from ever becoming an issue. We don't want you to develop diabetes and now there's diabetic kidney disease and you have one kidney. We want to prevent these things, or at least if you already have them, then, be able to manage them. And then other lifestyle things too is, making sure ideally being at a healthier body weight and not smoking and being physically active and sleeping good and having lower stress levels, which I know everything is easier said than done, but it's very important. Even if your kidney function is completely normal and looks great, these are all important things that you still want to do proactively so that kidney disease and declining kidney function is not something that ever comes up for you in your lifetime.
I think that's so important of a point because, understanding what you eat is so important. Even before you reach someone like me, you really ought to see someone like Michele so that you understand how to avoid seeing me. I mean, it's good for your health and it's also good for your wallet not to have to see me. So these are really practical things that everyone can and should do.
Yeah, definitely. And one thing I do have a question on, and I know you had addressed it, but someone specifically had asked this with, they had bilateral kidney masses removed through the partial nephrectomy. So I know you already talked about the partial nephrectomy, but is there anything else with if it was a mass or it was benign versus being cancerous, and any different considerations with that?
Yeah, this is really interesting. It is really hard on imaging to be able to tell if a mass is benign or it's cancerous. So there's a type of tumor called oncocytoma. And oncocytoma, its behavior is very, very benign. So the problem is when you are looking at it on a CAT scan or an MRI, it's really hard to tell the difference. Now, there are certain things called angiolipomas, which are basically fat sort of masses, and those are straightforward. You can identify them on imaging easily, don't have to do anything about it. But in other words, when we're thinking about whether we even should do a nephrectomy, that decision becomes really hard because we don't know. So we rely on how fast it's growing, what the size is there any infiltration going on? Sometimes we'll check other imaging studies like a chest x-ray or even a CAT scan of the chest to see if it's metastasized, because oftentimes it'll end up in the lungs. So those are things that you think about. Now, after it's all said and done and you've had the nephrectomy, the thing is realize that no matter what your kidney number is, give it time. Don't be so hard about it because it could take months, if not 1 to 2 years even, according to some of the data that we talked about earlier, for that new creatinine to stabilize. During that time, any additional insults to the kidney really matter. And just keep in mind, the reason we sort of obsess, or at least I obsess about weight so much, is because weight is an absolute marker. And what does that mean? Let's say that you came to me and you're 250 pounds of pure muscle, right? And then you come to me and you're 250 pounds of pure fat. Both of those are risk factors for your kidney. And the reason is it's way too much weight that your kidneys have to filter. It's kind of like your car engine, right? If you drive your car less, the engine is going to last longer. If you put less pressure on the engine, it does better. You are born with about 1 million kidney cells in each kidney. All that happens is they die as they get older. So as a result of that, lessen the pressure. So one of the best things you can do, especially before a nephrectomy and after a nephrectomy, is getting towards that healthy BMI, that healthy weight. I can't stress that enough because that's the single most effective thing you can do to lower just about any risk.
Yep. So important. And I think too, is a lot of times what we don't want to happen is when we focus or when we talk about importance of being at a healthy body weight, that can look different for everyone, of course. But, when we focus on sometimes, I feel like when we go in this realm of weight loss, then that's where we get in a lot more of the fad diets and we get in quick fixes. And just like you said, the kidneys can take 1 to 2 years to kind of stabilize. It takes time to lose weight. And I think part of it is if you focus on the health habits that we're trying to form, like I'm doing this for my overall health. I'm doing this to protect my kidneys. I'm doing this, yes, to lose weight as well, but also to, lower my risk of heart attack, to lower my risk of cancer, all these different things. And we think of it in that way. You see, one, I think it's usually more motivating, but you can see improvements that are outside of just weight and just the number on the scale. And a lot of times that's just motivating because it's a process, right? It's a process protecting our kidneys, and it's a process losing weight, and a process maintaining that weight. But looking at it from an overall health standpoint is so much more, I think, motivating and inspiring than just, I got to lose weight.
Yeah. So this is interesting because one of the best predictors for weight regain is how fast you lost the weight. Mm-hmm. The faster you lose the weight, the more likely you are to regain it.
Yep.
And it's just a general principle, and it's held true in studies. It's held true in my clinical practice with thousands of patients, and it's a fact. It's not one of those things that we're joking about. So when you think about weight loss, don't do it so rapidly. Anybody can do a fad diet for January 1st, New Year's, and then a few months later, they regain all of it.
Yeah. So for someone who, getting back to one kidney, so someone who was born with one kidney, they donated their kidney and now have one kidney, or they've had a partial or full nephrectomy, how often should they be monitoring? I guess what should they be monitoring, and then how often should they be monitoring that to make sure that their one kidney is as healthy as possible?
Yeah, this is one of those it depends questions because it really depends on what your risk factors are. So, are you overweight or obese? Are you hypertensive? Are you diabetic going on? Do you have lots of cholesterol floating around? If you have those things, then your doctor will monitor you very closely because of the fact that they want to recheck those labs to make sure they're stable. If you don't have any of these and you're otherwise healthy and you had a partial nephrectomy going on, then we'll go ahead and check your creatinine maybe 3 to 6 months to see where it is. So we'll check all your lives, we'll check your hemoglobin, all that stuff. And we just want to make sure it's stable. If it's stable, then we just check it about every 6 months or so. But remember, everything is different depending. Some people may check it every 3 months because of the fact that they really want to make sure in the beginning things are stable going on. But it's what other risk factors you have. So if you have high blood pressure, if you have diabetes, and if you have extra weight, remember those are the 3 biggest drivers of developing kidney disease. And those are the things we're really concerned about, along with things like if your cholesterol levels are not optimal, we want to work on controlling those.
Thank you. And I have another question I thought of. How invasive of a surgery is a nephrectomy? And is it different for a radical versus a partial nephrectomy?
Yeah, so this is a great question, right? Because there's more and more techniques that are being developed. People are using robotics now in terms of doing nephrectomies going on. So every surgery, bottom line, is going to be invasive. But in terms of, the open nephrectomies, a lot of the people that are doing now, they're doing them laparoscopically, which means that instead of making the big old incision that you would see in the old days on the sides of their bodies, they're making small holes where they're able to put the instruments, able to get the kidney out, and it's much better. And with the robotics assistance that they're starting to get, it's a marvel to see how quickly people are able to get a nephrectomy and leave. Now remember, in the old days, and it still goes on, where in certain countries, God forbid you wake up in a bathtub with ice and your kidney's gone. But that's how crazy it is, and people still walk out. So nephrectomy in general is not a very complex surgery, and our surgeons have gotten really, really amazing, and the technology has gotten really, really amazing. So really, from a safety perspective, it is incredible to be living in this day and age today.
Yeah, thank you. I was just curious about that. I think that was all. Do you have any other questions around anything solitary kidney nephrectomy?
I think this covers, our episode here. And what I would tell everybody is, once again, we try to give you some guidance around this stuff. Nephrectomy is a very, very personal decision that comes between you and your surgeon. You want to have those discussions. You want to think about your risk and benefits. And you also want to think about, the timing of it. So please never delay anything, especially if there's a concern that it's metastatic. Talk to your doctor. Make sure that you're listening to him or her. If you feel like, this doctor isn't working for you, get a second opinion. There's nothing wrong with that. I know sometimes people are afraid to do that, but listen, I welcome second opinions. I get a lot of people coming to me wanting to get my opinion on things. And what that shows is that the patient is part of the solution, that they're going to take an active role in their healthcare. So my advice always is please don't delay something that you heard on the internet or anywhere else. This is your health. And you got to know which people to trust and guide you. And with that, Michele and I we take these episodes very seriously. We look up the data behind it. We want to present you with evidence-based information to guide you. But these are important decisions that you got to make sure that you have the right team around you.
Yep, that's so important. Someone that you trust. And again, there's nothing wrong with getting a second opinion and switching doctors, switching dietitians even, right? If you're not clicking with that person or getting the support that you feel like you want and you need and you deserve, then, you can always move your care elsewhere. So, all right. Well,
all right. With that,
go ahead.
Let's wrap it up.
Yeah.
Okay.
Just a reminder.
I'll get... No, Michele, you should do the closing.
Okay. Well, just reminding you guys, again, submit your questions, plantbasedkidneyhealth@gmail.com. If you guys can please, like and share this episode with your family, friends, anyone that that would benefit. If you're listening to on podcasts, of course, subscribe to the podcast, leave us a review. It really helps other people to find our episodes and find our podcast and our YouTube channel. And again, questions. We have we have a shared Google Doc of all the questions that people have been submitting from different places, Instagram and the email. But that email again is, plantbasedkidneyhealth@gmail.com. Anything else you want to add?
All right. Thanks, everybody. No, that's it. We'll see you guys next time.
All right. See you guys next time.